Welcome back. I'm Siddharth Talia and a very good evening. We're of course tracking the COVID-19 situation, not just in China, but the possible fallout that it might have in other parts of the world, including India. Now, there are currently 10 different variants of COVID-19 in the country. The latest such variant is BF7, of course considered to be fairly lethal and is having a devastating impact right now in China. At present, only different variants of Omicron are currently spreading in the country. Even today, the Delta variant is also prevalent in some parts of India. India currently has about 3,400 odd active cases as we speak, but there are other variants still prevalent and the country and the authorities need to be vigilant. Now, let me in fact go across to Amit Kumar for more updates coming on this. Amit, काफी सारे ऐसे वेरिएंट्स हैं कोविड-19 के जो अभी तक प्रेवलेंट है इंडिया में, इसीलिए सरकार कह रही है कि विजिलेंस अभी भी बरकरार रहना चाहिए।
ये देखिए, सरकार ने आज इसको लेकर बैठक की। आज बाकायदा सुबह गृह मंत्री स्वास्थ्य मंत्री ने एक बैठक की जिसमें तमाम अधिकारी मौजूद थे और उसमें फोकस यही था कि जिस तरह से अब चीजें बढ़ रही है, अचानक कोविड के संक्रमण की संख्या बढ़ रही है, तो उसके लिए क्या करनी चाहिए। तो उसमें पाया गया कि देश में भी कम से कम 10 अलग अलग कोरोना के वेरिएंट है। इसमें सबसे जो ताजा वेरिएंट है वो BF7 है। हालांकि फिलहाल ओमिक्रॉन के अलग अलग वेरिएंट ही फैल रहे हैं, लेकिन देश में आज भी डेल्टा वेरिएंट के जो कुछ जो चीजें हैं वो दिख रही है। तो ऐसे में थोड़ा सतर्क रहने की जरूरत है। मास्क जो है, अगर आप भीड़भाड़ की जगह में जाते हैं तो पहनना जरूरी है। इसके अलावा एयरपोर्ट पर चीन के रास्ते जो भी आ रहे हैं, चीन से आने वाले जो विमान है और उनके जो वहां से आने वाले यात्री है, बाकायदा उनकी टेस्टिंग शुरू हो गई है। उनको जांच करने के लिए कहा गया है कि चीन से जो भी है, क्योंकि वहां पर हालात बहुत बिगड़े हुए हैं। तो अपनी तरफ से सरकार ने प्रिकॉशन मेजर्स शुरू कर लिया है। अलग अलग वेरिएंट है, लेकिन हाँ, इतना जरूर स्वास्थ्य मंत्रालय के अधिकारियों ने कहा कि अभी वो पोजीशन नहीं पहुंचे, कोई भी वेरिएंट वो उतना खतरनाक नहीं है, उतना नुकसान करने वाला नहीं है जैसा कि जब डेल्टा वेरिएंट आया था 2021 के दौरान। तो उस तरह से सिचुएशन नहीं है, लेकिन प्रिवेंट करने के लिए सरकार ने अभी से तैयारी शुरू कर दी है और इसको लेकर जागरूकता भी आनी चाहिए लोगों में कि मास्क जो है, अगर आप भीड़ में जाते हैं तो पहने और जो प्रोटोकॉल्स है उसको फॉलो करना शुरू करें ताकि ये ज्यादा फैले नहीं। तो अपनी तरफ से सरकार ने बैठक भी की, हालात का जायजा भी लिया, जो जरूरी कदम है उसको उठाने के निर्देश भी दिए गए हैं।
और अमित, क्या कोई आशंका है अभी सरकार में? आपके सोर्सेस क्या कह रहे हैं? अगर सिचुएशन थोड़ा वर्सन होता है, यहाँ पे भी केस काउंट, डेली केस काउंट जो है वो बढ़ना अगर शुरू होगा तो काफी सारे मजबूत स्टेप्स लेने पड़ेंगे सरकार को अभी भी।
जी देखिए, सबसे पहले तो क्योंकि छुट्टी का वक्त आ रहा है तो आपको बाजार से लेकर जो टूरिस्ट प्लेस है वहां पर।
Okay, Amit, I just need to interrupt you there because we're also being joined right now by Dr. Bagai for his perspective on the prevailing situation. Dr. Bagai, thank you so much for speaking to us. Do you apprehend that there could possibly be a fallout of what's happening in China, in India? Are we going to return to what we witnessed a couple of years ago, or is that still a long way away with adequate steps already having taken and perhaps a sense of immunity in India being greater than the prevailing situation currently in China? What's your assessment?
Hi, good evening. The ripple effect probably be seen worldwide. But having said that, India is in a much better position because a very large segment of our adult and vaccinable eligible population has already received the double vaccines and more than 50-60% have received the boosters. The vaccine efficacy of the Indian vaccines is far superior to most of the international brands, leave alone China, which is not worth talking about at all. What we are actually now seeing is the resurgence of certain new sublineages which have a great vaccine escape and an immune escape mechanism. Mainly what we call as BF.7, which is actually a name for BA5.2.17. This is the breakaway of BA.2. These are the new sublineages. So I think we need to be cautious. Masking would probably be useful in very large crowded areas, which are best avoided to begin with. But otherwise, I don't see any fear. I don't think there is any panic. I don't think we would revert back to the condition of 2020-21. We will not see a huge wave as such. We may see a small rise in number, but precaution is the key, and I think the Indian government is very much attuned to managing the situation. We are already taking preemptive steps. The medical infrastructure is far superior than what it was 3-4 years back. So very clearly, no panic. but finish your booster dose again, wear a mask, keep yourself clean, personal hygiene is important.
The booster percentage, Dr. Bagai, is somewhere to the tune of about 30% or slightly above. Do you believe that with the current vaccinations that have already been administered to the adult population in the country, is that something that safeguards us against some of the new variants that are now prevalent in China, including the B7 variant that you spoke of?
Yeah, absolutely. Indian vaccines and Covaxin, which are an adenovector-based time-tested platform, have served India very well.
Right, we're having some issue patching Dr. Bagai, but we'll get him back online very shortly. But like he was saying, the vaccines that have already been administered in India, which is predominantly Covaxin as well as Covishield, have proven effective against different variants of COVID-19. And he says he's fairly confident that even the B7 variant is something that these vaccines can provide a shield against. Let me in fact go back once again to Dr. Bagai. Yes, Dr. Bagai, you were of course explaining to us the efficacy of Indian vaccines against some of the new variants of COVID-19 as well, including B7.
Yeah, so the percentage, worldwide of the vaccines of vaccinated, which we call as booster, as fully vaccinated versus unvaccinated, it prevents mild disease and infections almost 9 to 11 times more than the vaccinated, ICU admissions and death almost 25 times. So I think it's greatly protective. Indian vaccines have an efficacy to prevent hospital admission, ICU admissions and death almost well above 92%. So I think we are in a much strong position. I think the protocols are very much in place. There may be a small segment of the eligible population which requires the third dose. So I would urge everyone to come and get it done.
Okay.
We need to just tweak the screening and the protocols a little bit in terms of genomic sequence and surveillance. But I think that's not a very tough task because, like I said, the infrastructure is already ready. We don't have to rebuild the wheels. But I think China is in a very, very precarious position. What would be paramount importance is to rethink our travel advisory with regards to China. People going in and coming out from there, at least a 30-day travel should be highlighted, and the patients.
You hit upon a very important point there, Dr. Bagai. Please do stay with us because that's exactly what we're coming to right now, where the government has now decided that the investigation of those coming from China will in fact be stepped up with regards to their condition at the time that they enter India. The Health Ministry has asked to check those coming from China at the airport premises very thoroughly. Let me in fact go across to Amit, who has all the updates about this. जी अमित, तो ये बताइएगा कि जो चाइना से पैसेंजर्स इंडिया आ रहे हैं उनको किस तरह की स्क्रीनिंग की जाएगी अभी? Well, let me in fact go take this across to Dr. Bagai. Like you said, Dr. Bagai, it's absolutely paramount and important at this point in time to be screening thoroughly those arriving on Indian soil from China, and this government has now announced steps to screen them thoroughly before they enter the country. So obviously an important step there.
Yes, indeed. I think a travel advisory would be very much needed. Anyone who's having had a history of visiting China or nearabouts in the last at least 3 to 4 weeks should be flagged. Surveillance at the airport, I think, would be necessary, especially for people who have international travel where the cases are up. I must add there are a lot of parts of the world, barring China also, who also are having an upsurge of cases, including US and most parts of European Union, some countries in Southeast Asia, and indeed Japan and Hong Kong. I think we need to be cautious. There are more than 620 sublineages of Omicron. That's a whopping number. So I think China has become more vulnerable because a very large segment of unvaccinated or partially vaccinated and a very poor platform are now suddenly become susceptible because they are exposed to the virus. And these are the new sublineages which can hop, skip and jump beyond the routine protection.
According to one of the investigating officers at the World Health Organization, Dr. Bagai, he estimates that the surge in cases witnessed in China actually began during the hard lockdown that had been imposed in different parts of the country by the Chinese administration and not necessarily because of the loosening of restrictions. So do you believe that any strategy that veers towards imposing a fairly stringent lockdown could prove counterproductive even if there is a surge in cases? That's the question.
Absolutely. I think policy of what we call as zero COVID policy is zero intellect policy. And I repeat it again, it defies medical knowledge, it's unscientific. There is something which we call as a selective pressure which is put on the virus when it is kept isolated. A virus is a coexistent organism as far as humans are concerned. We must learn to accept that these kind of things are going to happen as a circulation within a community. What they should have done in many months back was a more scientific approach towards lockdown. Lockdown is never per city, per territory, per district, per zone in the third year of the pandemic. I mean, this is completely illogical. And they should have used a better platform. Most countries which have actually imported the Chinese vaccines have actually stopped using it 2 years back because it didn't work. The new sublineages have a greater breakthrough infection and greater reinfection rate. So I think even if they begin now with a proper vaccine strategy, a proper scientific approach, it would take a better part of 2 months, 3 months. But I dare say in these 2 or 3 months, there may be many, many thousand deaths which could have been totally avoidable.
What are the steps, and this is something that's foremost in the minds of a lot of Indian citizens, and they would want to know that given that there's an upsurge of cases right now in China, and in the event that there's some kind of a spillover effect in India, what are the precautions that they ought to take? So would you recommend that masking be made mandatory? Is that a prescription that you would actually give under the circumstances? What are the steps that Indian citizens should themselves take, and do you see any advisory to that effect being issued by the government as well?
Yeah, so I think we need to revamp our public healthcare awareness protocols. We need to re-inform the public that, we still are towards the fag end of it, but we are not completely out of it. Very large crowded gatherings are best avoided. If at all you
Dr.
attend,
Bagai, do stay with us. I just need to get a perspective in from Dr. Naresh Trehan as well. He's joining us on the phone line as well. Dr. Trehan, a very good evening to you. How do you see the situation right now in China as it's evolving? And do you apprehend a possible spillover into India? And what is your assessment of our level of preparedness right now with respect to COVID-19?
So there are three questions you've asked in the same one question. The point is, yes, today we are connected. There are people traveling all to and fro from every country. It's not only in China, it's in Japan. The US also is showing some signs. So the basic thing is that we should get alert to the fact that this breakout has happened in China and beginning in Japan and other places. So what should we do is the ultimate question. And the point is that we need to be watchful, like the health ministry has already said, given the advisory, that anybody who tests positive should be, there should be genome sequencing done on their sample to see if there's another variant of concern. Right now, we have many of the variants that are going around, but none of them seems to be creating major problems in the sense of people are getting infected even if they do, and there is a triple whammy to us. One is the fact that this is the flu season. Second is the fact that the pollution in North India is unbelievable. And third is the Omicron is lurching somewhere around us. So main question is, if you get a cold and cough, do not presume it's only flu or it's the weather or environment. Just wear a mask, separate yourself from the family so you can protect your family. And it's a 7-day event. That when you recover, 3-4 days later, I mean, a total of 7 days, we believe then you're non-infected.
Okay.
Now, unless something new emerges, we should be just cautious, trying to avoid very crowded places. And if you're going to sit somewhere for a long period in a crowded place, you should wear a mask.
Right. Many thanks for that perspective, Dr. Trehan, and also Dr. Bagai for having joined us on the broadcast for your insights.